Hi, I'm Dr. Memmo again. We're here at Orthopedic Associates of Hartford Surgical Center here in Rocky Hill. Today I'd like to introduce you to the location where I do all of my procedures. This surgical center is a state-of-the-art facility where I'm able to do procedures in a sterile fashion in an operating room where it can be done safely with my staff, nursing, to welcome you to do a procedure that is going to be comfortable and hopefully will get rid of your pain. So here in the operating room, this is where everything happens, okay? This is the examination table and the table that you're going to be lying on when we do the procedure. And then we also have what we call a fluoroscope or a C-arm, and that is this machine over here. Today we have our radiology technician. She's going to bring this over for us, and she'll show you how it works around the table so that I can visualize all the procedures that I do. So if you want to come and bring that over around the table. So as you can see, okay, they call it a C-arm because of this shape. And this allows us to get different views, and we can move this C-arm in many planes, such as an oblique view, or all the way around the table. And we can do what's called a lateral view, so that we can get a visualization of where the needle is placed within the human body. This allows us to do the procedure in an accurate way, in a safe way, where I'm able to put a needle within 1 millimeter of where I need to go. By using this fluoroscope, we're going to be showing you later some of the images that come about from doing this procedure. Also in this room, I wouldn't be able to do the things that I do without the nursing staff that I have here at Orthopedic Associates, who are fantastic. Today I have two of my nurses, and I'd like to introduce you to them. Okay. This is Brenda over here on my right, and Deanna. They're going to be helping me with a patient who's going to be coming in shortly for a severe pain in her leg. She has a disc herniation that we're going to go through and hopefully treat her really well. So right now I'm going to go through the anatomy that we spoke about earlier as far as someone having a disc herniation, what it looks like on the MRI, and then we're going to show you the results of the injection that we do on this person, which hopefully will alleviate her pain. So why don't you come on over here. First we'll go through the anatomy on the cadaver that we spoke about earlier. If you remember, these are all vertebrae, and these are discs. These are the nerves that come out. What happens is these discs are very much like jelly donuts. That gel can squirt out, and what can happen is it can cause compression of the nerve, and it can also cause inflammation and severe and debilitating leg pain. This is an MRI of the patient that we're going to be doing today, and as you can see, let me just clear this a little bit over here. If you look here, this is the front of the body and this is the back. And what we're looking at is we're looking at what are called sagittal views. These are the vertebrae and these are discs. At the L3-4 level, this patient has a disc that has extruded. See that gel that's come out? This is gel that's come out of this disc, and what it's doing is it's taking up space within this canal here. This is the central canal where all your nerves are. And what it's doing is it's pressing up against some of the nerves, and it's also releasing a lot of chemicals that are irritating all those nerves. So what we're going to do today for the patient is we're going to perform a transforaminal epidural injection at the L3-4 and L4-5 level. We're going to bring the patient in, we'll do the procedure, and then we're going to talk about what it looks like on fluoroscopic images. Right? We'll get that done in a second. Right now we're just going to mark it. Okay? All right. Great. And what I'm going to do. So I'm happy to say the patient did remarkably well today. She's actually doing really well, and she's recovering in our recovery area. Let me go through the anatomy again and what we did for our patient today. If you remember, here's the model. Here are the vertebrae, and here are the discs. I mentioned earlier on the MRI that the patient at the L3-4 level had a disc that extruded. It was right in this area here. So what I did on our patient today was do what's called a transforaminal epidural injection, where I put a needle here and I put a needle here. The image over here shows a side view. Here are the vertebrae, and here are the needles. And they're beautifully placed right in this area where you have that glob of gel. Okay? The next image I'm going to show, and again, these images are a result of our fluoroscopy. We used the X-ray machine, and we were able to get a side view, and we're also able to get a front to back view, which is what we're looking at now. The third thing the X-ray machine does, the fluoroscope, is it takes live pictures, which I'm going to show you in 1 minute. Here are the needles placed beautifully here and here, and that's what you see are the two needles. Okay? The next picture I'm going to show you is the introduction of contrast into the epidural space in this location. So I want you to look at this screen and pay attention right there. Here you can see the flow of contrast going in beautifully. This is called digital subtraction. It's the same technology that's used by cardiologists when they do an angiogram. It whites out the whole screen, and the only thing that shows up is the contrast. And you can see the contrast going in beautifully into the epidural space. And we also have a view here of what I also see. So this is the same picture, but this is without digital subtraction. It's showing the contrast going in safely and beautifully into the epidural space. We also did the level below that. Okay, and here's the L4-5 level. Again, the contrast going in beautifully. Okay, this is the digital subtraction. And over here on the right side, it shows the contrast going in beautifully. So you can see we kind of targeted that disc right in this location here from above and below. And hopefully this patient will do really well, and I think she will. So this is an example of what we do here at Orthopedic Associates of Hartford. The procedure is done safely, in a sterile fashion, in an operating room with state-of-the-art equipment, an X-ray machine, but most importantly, the nursing staff and all the administrators and the radiology technician, all of them help me do a great job here so that we can help you get rid of your pain. Thank you.